Hello, Assalamu alaikum. In this video, we will talk about the muscles of mastication. Muscles of mastication are four in number. Number one is temporalis, then masseter, and then lateral pterygoid, then medial pterygoid. These are four muscles which are called muscles of mastication. So we will go to all of them one by one. So here you can see there. This is the muscle which is called temporalis. Temporalis. Look at this temporalis muscle. It actually arises from the superior temporal line, then temporal floor of the temporal fossa, and overlying temporal fascia. So this muscle originates from the superior temporal line, floor of the temporal fossa and temporal fascia. And look at the this muscle. This is actually a Chinese fan kind of muscle, which is broad in its upper part. Then all its fibers, they actually converge to a point where they actually, you look at this white area, they converge, all the fibers they converge, and they make a strong white tendon, and that tendon actually gets attached to the coronoid process. Here it is the coronoid process. They attach to the anterior border of the coronoid process here, then tip of the coronoid process, then on its medial surface, in medial surface of the coronoid process, here you can see the lateral surface, on the other side is medial surface. So this muscle actually has got three types of fibers: anterior fibers, middle fibers, and posterior fibers. Anterior and this anterior and middle fibers, they actually, when they contract, look at the direction of fiber, they are vertical actually. When they contract, they elevate the mandible, whereas look at these posterior most fibers, these are almost horizontal in direction. When these fibers they contract, actually when they contract, they decrease these horizontal fibers, they decrease their length, and as a result protruded mandible is retracted. So this was the temporalis muscle. Then here we have got masseter. Masseter muscle is actually, when you look at this muscle, this muscle is attached onto the zygomatic bone, inferior border on the medial surface, and zygomatic arch here down. This muscle actually has got deep fibers and superficial fibers. Deep fibers are vertical, whereas superficial fibers, oblique they are oblique. So when vertical fibers they actually contract, so they raise the mandible, elevate the mandible, and when these oblique fibers they contract, they actually, look at the direction of the fiber, when they would contract, these red portion, fleshy part would the fiber would decrease its length. As a result, mandible would be protruded. So they elevate the mandible and protrude the mandible. Now this is the muscle which is called lateral pterygoid. Look at the muscle, it has got actually two heads. This one here you can see, this is upper head, and here is the deep head. This upper head of the lateral pterygoid, it actually originates from, this is the greater wing of the saphenide. They actually originate from the greater wing of the saphenide and infratemporal crest. Here you can see the infratemporal crest, and these fibers they actually gets attached to the capsule of the temporomandibular joint, and plus articular disc between this temporomandibular joint. Here you can see the gray curved structure with between these two bones. This is articular disc. So this superior head attaches itself or insert itself into the capsule and this articular disc. So whereas this inferior head, it actually gets attached to the originates from the maxilla or tuberosity of the maxilla, and it gets itself attached onto the pterygoid fovea, which is a depression onto the anterior medial aspect of the this head of the mandible. So these two heads, when these two heads look at the direction of fiber, they contract. They actually, the upper fiber, they actually protrude the mandible, whereas these look at the direction of this lower head. When they contract, they actually depress the mandible. So lateral pterygoid is the muscle which protrudes the mandible and it depresses the mandible. So lateral pterygoid, it is the only muscle out of four of the muscles of mastication which actually lowers the mandible, or it actually depresses the mandible. So my mnemonic for remembering its action is L for lateral pterygoid and L for low. So it depresses the mandible, or it depresses the mandible. So here you can see, this is, you are looking at from the posterior aspect. Here this is the medial pterygoid muscle, medial pterygoid. This is medial pterygoid plate, pterygoid humulus, and here comes the lateral pterygoid plate. So actually this muscle originates from the medial surface of the lateral pterygoid plate. Between, here you are looking at this, between the two pterygoid plates, it arises from the medial surface of the lateral pterygoid plate, and it gets attached onto the ramus of the mandible on its medial surface, ramus of the mandible on its medial surface. Now so look at the this muscle. Whenever this muscle would contract, these fibers would contract, it would actually elevate the mandible, and plus it would be protrude the mandible. So all the muscles of mastication, they elevate the mandible except for lateral pterygoid, and most of them, they actually protrude the mandible. For example, lateral pterygoid would protrude the mandible, masseter would protrude the mandible, medial pterygoid would protrude the mandible. Only temporalis muscle with its posterior most parts, muscles which are horizontal, they would retract the protruded mandible. So now the nerve supply of this, look at this, is the mandibular division of the trigeminal nerve. Mandibular division of trigeminal nerve. Muscles of mastication are derived from the first pharyngeal arch embryologically. So the nerve supply of first pharyngeal arch is mandibular division of trigeminal nerve. So that's why mandibular division of trigeminal nerve would supply all these muscles. Here you can see anterior and posterior deep temporal nerve, they are supplying the this temporalis muscle. Then there you can see nerve to the lateral pterygoid. This is lateral pterygoid muscle. Likewise medial pterygoid and masseter muscle, these all muscles are supplied by the mandibular division of trigeminal nerve. So this was bit about the muscles of mastication. I hope you will enjoy the lecture. Thank you very much.